Welcome back to Healthy Living. We are joined now by Dr. Brousse. He is a gastroenterologist with the Gastro Group and Endo Center in Covington, Louisiana. And also, as Jay mentioned earlier, the Gastro Group and Endo Center is our presenting sponsor for our upcoming Man Up event on June 16th. So welcome, Dr. Brousse. Thanks for coming in today and talking with us.
Appreciate you having me.
Well, we appreciate you coming and taking time out. First, let's just tell people a little bit about you. What do you like about St. Tammany, the community, and tell us about what you do at the Gastro Group.
Sure. So, native son of Louisiana, born out in Araby, grew up in Metairie, stayed here for my medical training and everything. I did venture out a little bit for residency and fellowship out in Mississippi, but came back. I just started last July over at Gastro Group.
Okay.
And so far, everything's been wonderful. St. Tammany is probably one of the best hospitals I've worked at in my medical training and career so far, and just everybody's been super nice and welcoming. I'm over there most days, kind of doing the inpatient service, but I'm also out in clinic and the endo center, seeing patients out there.
So let's talk about a gastroenterologist. You're board certified in gastroenterology,
Correct.
And we know that it deals with disorders of the gastrointestinal tract and the digestive tract and the organs around this area related to it. So tell us a little bit about what do people come in to see you about? Like, what are some of the disorders that affect us?
Sure. So we see everything basically from tip to tail is what we kind of joke about.
Okay.
Basically disorders of the esophagus, the stomach, the bowel or colon. We also deal with the liver, gallbladder, pancreas, so kind of everything that runs in that digestive tract. People typically come into us for all the common stuff, reflux, irritable bowel syndrome, colon cancer screening, obviously. And then some of the more advanced cases like inflammatory bowel disease and other liver dysfunction and such.
So you can help a wide range of people with a wide range of problems, it sounds like.
Exactly.
And we know that you'll be up at the your group will be at the Man Up event, and primarily you'll be doing colorectal screening and education.
Correct.
So let's talk about the significance of understanding your risk about colon cancer and why screenings are crucially important.
Sure.
What's the point of a screening, basically?
Yeah, of course. So colon cancer is the third most commonly diagnosed cancer in the U.S. for men and women. It's the second leading cause of cancer death in the U.S. as well. We've done a good job over the past 50 years with screening initiatives to kind of get that incidence and mortality down over time. But what we're finding is that actually in younger people that risk is going up, and where actually the incidence is rising, which led the U.S. Preventive Task Force just a few years ago to lower that screening age from 50 down to 45.
Okay.
I think a lot of people are they weren't really sure of or knew about. So we're trying to get the word out there more so that now we're attempting to cast a wider net to try and get those people, because what we found is that the incidence of colon cancer and colon cancer death actually goes down with these screening initiatives. So just trying to educate people more that they need to get tested and need to get tested sooner, because we are seeing this on the rise, and it is something that we can work on preventing in some cases.
Right, and we were talking a little bit earlier that, people kind of dread the colonoscopy because they don't know what to expect.
Exactly.
And in truth, there is a little prep that goes into it that can be dreadful for some, I guess, but the procedure itself is very fast, and you don't feel a thing. You're sleeping.
Yeah. So on average, there is a little bit of a clean out process, and I know most people dread that. I know it's a little daunting for some people who have gone through it in the past, that you have to drink this big jug of stuff and you're going to be up all night. Unfortunately, we do have to clean you out so we can see what we're doing, but there are more options out there for preps these days. Whether it's the jug, it's pill preps, it's smaller volume preps. Ultimately, there's better options out there these days than there used to be. And as far as the procedure itself, I always tell people when they come in that they're through the worst part of it. They're basically going to come in. We do sedation on most patients if they choose to. We can do them unsedated if people are concerned about the sedation risk.
Right.
But generally pretty safe medication that's fast on, fast off. You get a great nap is what I tell people. And generally the procedure lasts about, on average, 20 minutes or so.
Yeah. And during that procedure, that's when you can see something that's looking suspicious, but you see it early most times, correct?
Correct. So on average, we Generally, we go in there, we're looking for polyps, obviously, adenomas, which are precancerous lesions. We know that about 70% of cancers arise from those adenomatous polyps, which are what we're hoping to find and take out while we're in there.
Right.
There's also a different class of polyps called sessile serrated polyps. That's about 25 to 30% of cancers develop. So our goal is really to go in, get these polyps out before they have the chance to turn into anything more worrisome.
Right.
And try and catch it early, because we do show that increased. And even if we do unfortunately find colon cancer, if we can find it earlier, those 5-year survival statistics are pretty good if we catch it early enough. And then, like you kind of alluded to, colonoscopy is the only modality we have that's both diagnostic and therapeutic. So you kind of get one-stop shopping. We go in, we find something's wrong, and we're able to take care of it for the most part while we're in there.
Yeah, and this is, I know we're talking about Men's Health Month, but you know, women are at risk for colon cancer as well. So we're speaking to everybody at this point about it. So we know that you'll be out there at the Man Up event. You'll be doing some of that education. You'll offer some screening possibilities. So what are some other things that you treat? We talked about reflux, pancreatitis, diverticulitis. Tell us about your gastrointestinal system, and how do you keep that healthy and avoid coming to see you if possible for some of these things?
So in general, it's kind of all the basic health principles that most of your doctors have probably talked to you about at some point. It's maintaining a healthy weight, eating a good healthy diet. We do notice that there is an increased risk with processed meats, increased red meat intake and such. So kind of not saying you can't have those things, all things in moderation, of course. But focusing more on those lean proteins, fruits, vegetables, whole grains, those kind of things. I always tell people kind of shop on the outside of the grocery store, not in the aisles if possible, just to avoid those processed foods, because we have noticed, partially in kind of that increase in colon cancer that we discussed earlier, a link has kind of been associated since the 1990s. We've noticed a little rise in younger populations, and there's some thought that our Western diet maybe has something to play with that.
Yeah, so eat the fresh foods, foods for sure. So tell us a little bit about before we wrap up, tell us about the group that you work with, the gastro group and endo center. Where would people find you? How would they come and make an appointment?
Sure. So we're right down the street from St. Tammany Hospital. We have our Covington office. We also have an office out in Slidell, near Slidell Memorial Hospital.
Okay.
So we kind of cover both sides of the North Shore on that aspect. We have 9 providers in total with 2 nurse practitioners. We're seeing patients 5 days a week. We're scoping 5 days a week. Just contact our office, and we're happy to get you set up for a visit. And if you have any concerns anywhere, like I said, from tip to tail, we're there for you.
All right. Anything else you want to add?
No, just hope you come out to the Man Up event. We're really looking forward to seeing everybody out there. And if you have any questions, obviously we'll have providers out there to answer those for people, and just kind of help take some of the stigma away from kind of what you may think is going on, and kind of work you through the process so you understand it better. Okay, well, thank you again for joining us, and we hope that everyone comes out to the Man Up event. You'll be able to meet Jay, you'll be able to meet Dr. Brousse, and have a little fun. You know, we'll have all kinds of things. And again, thank you for being a presenting sponsor. So stay tuned to Healthy Living, where we have one more segment coming up, and we're going to speak with Arlene Arsenault. She's the Director of Cancer Services, and she also works in the St. Tammany Health System Infusion Suite at the St. Tammany Cancer Center. So we'll be back with Arlene in just a couple minutes.